Welcome, everyone, to the Positive Veterinary Dentistry podcast, the podcast dedicated to helping veterinary professionals elevate patient care through better dentistry, better diagnostics, and better decision-making. I'm your host, Benita Altier, licensed veterinary technician specialist in dentistry, and the founder of Positive Dental Education. Whether you're listening in general practice, specialty practice, academia, or you're still in training, this podcast is designed to give you practical insight, historical perspective, and clinical pearls you can take right back to the dental table. Today's episode is truly special. We're going to step back in time, not just to talk about techniques or materials, but to hear the living history of veterinary dentistry from someone who helped build it. This episode is the history of veterinary dentistry in the 20th and 21st century as told by Dr. Edward Eisner. Dr. Eisner has prepared a timeline of stories spanning decades from the early days when veterinary dentistry was barely recognized to the highly specialized advanced discipline we practice today. This conversation is less about questions and more about perspective and mentorship, about growth and about how this profession was shaped and what it took to get here. So, let me introduce my guest. Dr. Ed Eisner is a board-certified diplomate of the American Veterinary Dental College and one of the founding diplomates of the Zoo and Wildlife Dentistry Certificate Program. He retired in 2020 as Chief of Dental Services at VCA Highlands Ranch Animal Specialty and Emergency Center in Colorado. Over the course of his career, he has served as the president of the American Veterinary Dental College, the Academy of Veterinary Dentistry, the Denver Area Veterinary Medical Society, and the Colorado State Board of Veterinary Medicine. He serves as the vice president currently of the Peter Emily International Veterinary Dental Foundation and continues to work on the executive committee of the AVDC Zoo and Wildlife Certificate Program. He has authored more than 70 professional papers, more book chapters, textbooks than you can count, and he's received numerous awards, including, which I was very impressed, Colorado Veterinarian of the Year, and also from the technician group as well. So welcome to the Positive Veterinary Dentistry podcast.
Well, thank you, Benita. Very glad to be here, and I'm excited to share some of this information with you about the history of U.S. veterinary dentistry in the 20th and 21st century.
Absolutely. I wanted to do this podcast with a focus on history episodes like this because I feel that verbal history is so important to capture. People such as yourself had such an instrumental role in creating dentistry as what it is today. And I think a lot of veterinary professionals take that for granted. They don't really understand what it took to pave the way, be the pioneer in veterinary dentistry to help everyone educate themselves because it wasn't done in veterinary schools. So as we start, I'd love to have you use your timeline and your stories that you want to share with us to take us back to the beginning. What did dentistry look like when you first entered the veterinary profession out of school?
Well, if you want to take it, Benita, to the very beginning,
Okay.
There were two major time periods. The first in which the horse was the focus of most of the attention, and that was because of its importance in transportation, mechanical power, military use, and sport. The second period involved the pet domestic animals, initially with dogs, and started to apply to non-domestic animals more recently. In the ancient world, we have only a very incomplete glimpse. There was a tremendous fire in the Library of the Ancient World in Alexandria in the current era of 391, and we lost 700,000 volumes of that fire. We do have approximately 1,000 volumes remaining from the ancient Greeks. Some of them are in Sanskrit, some of them in Greek, some of them in Roman, some in Arabic and Egyptian. By the end of the 1800s, the horse was being replaced as a result of the Industrial Revolution. That being said, I think we can get into the more salient topic for the day, and that's the current veterinary dental evolution that happened in the mid-1900s, currently in the 2000s. So anyway, very early descriptions of dental and oral surgical procedures in dogs would horrify us today.
I bet they would.
Indications were sometimes based more on superstition than on medical reality, such as the belief that the tooth worm was the cause of cavities and periodontal disease. So, but more recently, the first attempt to organize veterinarians in a special interest in animal dentistry in the United States, it took place in 1976. At a meeting, doctors Gary Beard, Don Ross, Dan Hillman, Thane Short, Ben Colmery, and Charles Root orchestrated the birth of the American Veterinary Dental Society. No credentials were required, no examination was administered, and Dr. Colmery really ran the organization from 1976 to 1984. In 1976, I became involved with what was to me to be a 50-year career in veterinary dentistry.
Amazing.
This was a time for me when the half-life of veterinary information seemingly was 7 years as information floated from California eastward to Denver. It was a time when on the Front Range of Colorado, we had spay clinics were appearing up in Boulder, and vaccination clinics were sprouting up in grocery store parking lots, offering services from mobile units. These two factors greatly negatively impacted the incomes of general practitioners. So I opened my practice 5 years earlier in 1971. I was in the early stages of being a director of a future very successful AHA hospital. It was called the Campus Veterinary Clinic
Okay.
in Denver. Two services that propelled me into being among the top 1% of hospitals in North America were proactive comprehensive diagnostics and dentistry. The diagnostic stimulus was provided by one of my father figures, John Molnix. John was an endocrinologist at CSU, and at dinner one evening, he suggested that to be successful, I should provide services that others could not provide. At the time, blood chemistry profiles were generally only provided for animals 7 years old and older, and often only with specific tests and with client approval.
And they had to be really sick patients too, right? We
Yeah,
never did routine blood work on anybody just to check their health when they're well, right?
that's right.
Yeah.
So at that time, uh, in my practice, I started performing mandatory full diagnostic chemistry panels at 5 years of age on all my pre-surgical patients.
Remind us what year this is.
That would be in 1976.
Wow, that's
Yeah,
amazing.
yeah.
That's great.
I also required and administered intravenous fluids for all the patients undergoing abdominal and orthopedic surgery, whereas in most practices, these services at the time were optional.
Hmm.
So,
That was really good foresight to think about the future, not just like how do you make your practice successful right now,
yes,
but what would the future look like if this continues, where some of your general business was being taken away by these vaccine clinics and, as you said, spay and neuter clinics,
yeah.
and you had to pivot.
The dental stimulus occurred when I read a brief invitation in JAVMA in 1976 in the Journal of American Veterinary Medical Association. For $10, I could join the newly forming American Veterinary Dental Society, of which I spoke a few minutes ago. It was basically a support group. We all contributed to the newsletter, sharing our dental experiences, our dental equipment inventory, our supply lists, etc. It brought together individuals with special interest in the expertise of veterinary dentistry. And so in 1976, I should say, at the time, there was no dentistry taught per se in veterinary schools, other than extracting painful and abscessed teeth. So to learn more advanced dentistry into more detail, we had an alternate pathway since it wasn't being taught in the schools. Other than extracting these teeth, one had to either take classes at a dental school or study under a dentist.
And that's a
And
human dentist, correct?
yes,
Yeah.
right. So I learned from several dentists. Most of us took this as the beginning route in our dental careers.
No pun intended with beginning root, right?
For myself, in 1976, a pair of elderly clients, Georgia and Weir Hall, came to my office with their dachshund Liebchen. Liebchen had two fractured lower first molars. All I could do was extract the teeth. And Mrs. Hall said, well, she'd have her dentist call me. And I said, oh, sure. Well, she hadn't left the office for a half hour before I received a call from Dr. Martin Allen. He says, I'm a dentist, and if you know Georgia Hall, you know why I couldn't say no. When can we do it?
Okay. That's amazing. I love it.
So he came to my office. He brought with him a belt-driven electric piccolo arm dental drill, a laboratory drill. And I
Wow.
provided anesthesia, and he performed root canal therapy on those two molars and saved the teeth.
Wow, that's great.
And I was duly impressed.
Yeah.
A mo-
Yeah.
it wasn't a month later, I was at a party in Castle Rock, a southern suburb of Denver, sitting next to a man at a bar in the host's basement. And he said, my name's George Russell, and I'm a dermatologist from Boulder, and I'd like to trade professional questions with you. And I showed him a bump on the back of my hand, and he told me it was a ganglion. He picked up a book and whacked it, and it went away. He said, okay, my turn.
Yeah, okay.
He said, I have an old English sheepdog named Porky, and Porky needs a root canal therapy, and I have a dentist who will do it, but I need someone to anesthetize the dog. So we set a date at my office, and I provided the anesthesia, and Dr. Bob Olson provided the dentistry. He's a human dentist. And while we were having dinner afterwards with our wives, waiting for Porky to wake up from his anesthesia, Dr. Olson offered for me to come to his office on my days off to observe and see some dentistry. And I did this for the next 2 years. After 2 years, he brought out a Shine catalog and helped me order some equipment and instruments. And I became the owner of my own belt-driven electric piccolo-armed dental drill. I was in business. Anyway, the next year I decided every dog and cat in my practice should have its teeth cleaned, which was unusual.
Very.
And ultrasonic scalers were brand new to the field, not yet in my possession, so I cleaned the teeth manually with a hand instrument. The following year, the teeth were worse. I felt terrible. So at that point, I went to the National AHA meeting in Salt Lake City in 1978, and I spoke with the grandfather of veterinary dentistry. His name was Don Ross from Houston. And he gave me some pointers to improve my technique, including the value of ultrasonic scaling and polishing. And my patients did much better the following year. In 1982, I met Peter Emily, also a human dentist. We met at a catered reception during the opening of the new Denver Zoo Hospital. Someone who knew us both introduced us. Peter and I became instant friends, and we traveled to Las Vegas the following February to the Western Veterinary Conference, and there were speakers from the American Veterinary Dental Society. There was 5 speakers: Gary Beard, Ben Colmery, Tom Mulligan, Don Ross, and Chuck Williams. These names you continually hear, they were in the foundation of organized veterinary dentistry. We had found a home, Peter and I. We exchanged ideas with these half dozen speakers. Pete was, as well as being a dentist, was an American Kennel Club dog show judge for working dogs, and he would see problems in the show ring and he'd send them to my office. And for the following Thursday, And he came to my office every Thursday for 3 years. If it wasn't for Peter Emily, we would not have a dental college today. He may not have been the grandfather of veterinary dentistry, but he was the godfather. Being of Italian descent, he was very proud of it. So he helped me buy a used x-ray machine, dental x-ray machine. And I learned a tremendous amount of dentistry from he and Betty Glass, his expanded chairside assistant. In 1985, the AHA meeting in Orlando, AVDS representatives, Chuck Williams again and Tom Mulligan, met with then AVMA American Board Veterinary Specialists, the ABVS, members Doctors Don Sawyer and Bill Jackson and Bill Kay, well-known figures in early veterinary medicine in the United States, to discuss appropriate means for obtaining specialty recognition. Well, those guys were told that it was inappropriate to advertise a specialty if the service would not be readily available on a national basis. The concept was they suggested we should form a group with qualifying standards, with credentials review, with an examination for membership, and use that as a preparatory step for the formation of an AVMA recognized specialty organization. So a lot of time and effort went into this. A committee was formed to pursue the forming of an academy. Has been the case with each subsequent step in organized veterinary dentistry. Preparation was thorough. It had to be. The constitution and bylaws of all the AVMA recognized specialty groups were studied. With this information, a constitution and bylaws for the Academy of Veterinary Dentistry was drafted. In 1986, the Academy was created. They were required 3 years of study, completing a credentials package, and passing a qualifying examination. I hadn't taken the exam for 20 years at that point.
Sounds
But
like a
I
scary
passed it.
concept. Oh, good job.
I passed it and became a charter fellow of the Academy. I was elected its president in 1988 and 89. In 1987, the Academy was legally incorporated in Michigan, and the first credentials review and examination process were conducted in 1986 and 87 by 3 persons eminently qualified in veterinary dentistry. Dr. Keith Grove, he was a human dentist. He was a veterinarian graduate from University of Pennsylvania. He had a master's degree in periodontology. He lived in Vero Beach, Florida. Don Ross was the second person. He was from Houston. He had an MS degree in dentistry from the University of Texas Dental School, and he was a veterinarian. And then there was Peter Emily from Lakewood, Colorado. At the time, Peter had about 20 years of extensive experience in veterinary dentistry, working in collaboration with veterinarians in zoos and small animal practice. And he was an adjunct faculty member at the College of Veterinary Medicine at CSU. So these guys were subsequently required to take credentials and examination processes also before being accepted to full membership, or they remained as an honorary member, which Peter did. So we had the Academy was being formed, and we called for interested persons to make application for membership. 44 veterinarians submitted credentials, 35 were permitted entry to the exam, and 25 passed. The first examination were certified as Fellows of the Academy of Veterinary Dentistry, AVD. Gary Beard was elected the first president. Dr. Charles Williams, president-elect. Colin Harvey, secretary-treasurer. And myself and Ben Comery were on the board of directors as members at large. Subsequently, we had standing committees organized for the new credentials review and examination committees. In 1987 was a big stepping stone. The Academy of Veterinary Dentistry sponsored a comprehensive continuing educational forum in Cincinnati, Ohio. It was the first of the American Veterinary Dental Forums.
Cincinnati, Ohio. I did not know that, so that's a new one for me. I'd never looked back to see where the first VDF was held.
We invited the heads of anatomy and surgery departments of all 23 veterinary schools complimentarily with invitations to attend our meeting. And it was a huge success. On May 12th, the next year, 1988, because of the rapid and successful development of the academy, the ABVS, the American Board of Veterinary Specialties, realized they had no control. We were doing this independently, which is not enjoyed by politicians. So they recommended that we make application with the AVMA for the establishment of an officially recognized specialty college in veterinary dentistry. An organizing committee of 8, accepted by the AVMA, ABVS, was made up, and the chairman was Charles Williams, Gary Beard again, Ben Colmery, Keith Grove, Colin Harvey, Sandra Manfra from the University of Illinois, and Tom Mulligan from San Diego, and Don Ross, with Peter Emily as an advisory member. This resulted in quite a bit of jealousy and resentment among many Academy Fellows who weren't included in the organizing committee. Facetiously, we referred to them as the Gang of Eight. Early AVD members, this was because AVD members had been members of the AVDS. Many had grown up together with those chosen 8, acquiring similar initial dental education. Many perceived themselves as equally qualified, and some were, but actually the chosen 8 were either politically tightly connected with the AVMA hierarchy, or they were double boarded in the AVMA, or they were connected with human dentistry. So they were eminently qualified. And the AVMA would not entertain any requests that we made to expand the size of the organizing committee. It was limited to 8. In 1988, the American Veterinary Dental College became a reality, with the AVMA organizing dentistry as a bona fide standalone specialty organization. To be a member required 3 more years of study, another more extensive credentials package, and more involved 3-day written and practical examination. I passed that first examination and was accepted as an entry-level specialist and expert in the field.
What was the study involving during those 3 years? Did you or others have
Well,
mentors that you met regularly, or
Pete,
was it
Pete,
something
Pete was
different?
my mentor, Pete
Okay.
Emily, mentor, friend, and colleague, and we lectured nationally and internationally for 40 years.
Yeah.
In 2021, we published the first hardback textbook in zoo and wildlife, wild animal dentistry, and that's cementing his legacy of 50 years performing advanced level oral care on captive wild animals. We cited in that book 352 species with endodontic and surgical descriptions for many of them.
Wow.
So that's, and the others, they had their mentors. Peter was mine.
Yeah. So people did have someone, a human dentist, most likely, that they worked with, because there weren't very many veterinary professionals that could mentor someone at that time, right?
Absolutely.
Mm-hmm.
Yeah. So in 1988, provisional approval for the AVDC was granted by the ABVS on July 17th. The ABVS set a goal for us, okay? We had to have 100 diplomates to have sufficient perceived specialty dental coverage to provide adequate service to the nation. They estimated it would take us 10 years to do this. Steve Holmstrom, he was the 4th AVDC president from 1994 to 96. I was the 5th from 1996 to 98.
Okay.
So in 96, after giving presentations at the National AHA meeting in Boston, Steve and I flew to Schaumburg, Illinois, and promised the ABVS we would have those 100 diplomates within a year. Well,
Okay. Campaign promises.
exactly. We didn't quite meet that goal, but our promise resulted in the same desirable, successful outcome. 1997, the AVDC was awarded full recognition as an AVMA specialty organization while I was the college president.
Oh,
Exactly after 10 years of the initial probation, we were awarded that honor in Reno at the annual AVMA meeting in July 1997.
excellent. Wow. What a journey to just get to that point, to have your 100
Oh,
members.
and the work effort was tremendous. I mean, we're talking in the 80s, we didn't, we had computers, but we didn't have an internet till the 90s. It was all done by hand, typed, copied, with whiteout marks and the whole bit. My credentials package was two binders 4 inches thick when I submitted my credentials. Very labor intensive. Today we have a DMS or a document management system, much more streamlined.
Yes. I don't think people realize what a heavy lift that is and how dedicated you have to be to make that work when you don't have the technology and tools that we have today.
Well, and I didn't know how I was going to do it. I had a new child, and which took a lot of family time. I would get up at 3 in the morning and study for 2 hours every day before family woke up, and we'd start the day. And I did this for 3 years.
Yeah, and you were running your own practice as well, right? Trying to keep your practice
Oh,
successful.
absolutely. Yeah.
So, what did dentistry look like at your practice between 1988, 87, and
I
97?
had a general AHA practice
Hmm.
of medicine and surgery.
Were you
And
growing the number of patients? Because you mentioned that your goal was to have every dog and cat in your practice get
yeah,
anesthetized to have their teeth cleaned. Is that
yes.
something that you were seeing improvements with the general public at that time? Because we have to educate the pet parents, so to speak, to get them to say yes to what we're offering. How did you find that to be between that time period?
Well, my staff said I had a silver tongue.
Okay.
As I tell people getting into practice, you have to know your craft, and once you feel secure that you're providing the service that you're advertising, your clients will hear it in the tone of your voice. If you're not so sure, they don't sign up. So, to get back to where we were AVDC was awarded full recognition as an AVMA specialty organization in 1997 in July. And there was obviously potential at this point for public misunderstanding of the difference in the qualifications to be a fellow of the academy or a diplomate of the college. Anyway, there was considerable overlap between the two. It just was increased credentials and a longer examination, etc., to become a diplomate. Many of us in the college were still members of the academy, and I still am today. And the academy no longer exists today. It doesn't have a credentials package, it doesn't have an examination. It's basically a committee in the college. The academy always, once the college was established, was kind of used as feeder stock, if you will, a stepping stone to the academy, because you do your credentials for the academy and the examination, and then you just add to them a bit and then make application to the college. But the academy was never recognized by the AVMA. Only the American Veterinary Dental College is an AVMA organization. In 2023, the Foundation for Veterinary Dentistry was formed. And was to solve the problem. It brought the Dental Society, the Academy, and the college all under the same umbrella in the foundation. The AVDS, the society, ceased to exist. The members still paid dues and received a Journal of Veterinary Dentistry, but they were now foundation members without being encumbered with a credentialing process or an examination. The foundation co-sponsored the American Veterinary Dental Forum, and the Journal of Veterinary Dentistry became the official journal of the organization, and 11 other national and international veterinary dental organizations.
I think you said 2023, but did you
Yes,
mean 2003? Or was it
23.
23? Okay.
Just recently, we
Yeah.
had a foundation that brought it all under an umbrella.
Okay.
Politics grinds slowly.
Mm-hmm. Okay. Okay. For some
Um,
reason, I thought that was farther ago.
so, with this foundation, the college kept its individual identity as the recognized specialty organization of the AVMA. In 2025, just last year, we finally got veterinary dental specialist and board certified veterinary dentist to be registered trademarks, because we continually have problems of people exaggerating their status, calling themselves specialists when they have nowhere near specialist abilities.
Correct.
So this helps protect that.
Yeah, that
Uh,
was a great accomplishment to get that.
yeah. So that's where we are as veterinarians. Then we come to the veterinary technician evolution.
Exactly.
The expansion of veterinary technician dental education and expertise was another aspect of this dental evolution.
Yeah.
Technician programs accredited by the AVMA were developed in the 1970s, but similar to veterinary schools, dentistry as a separate discipline was not taught. In the 1990s, the Henry Schein Dental Distributor Company, spearheaded by their sales manager Jerry Sellen, created the American Society of Veterinary Dental Technicians, ASVDT. It was an uncomplicated, unaccredited beginning. Mr. Sellen wrote an educational compendium, created a take-home examination, collected a fee, and a veterinary technician could receive the educational materials and the take-home book examination. Once the tuition fee was collected, they received a certificate of completion and a membership to the ASVDT.
I was one of those people that did that.
Yeah, well, it was the beginning.
It was what we
But
had available to us.
yeah,
Yeah.
there was no oversight, and the quality of the ASVDT members understandably varied tremendously, and it tainted the perceived overall quality of veterinary dental community. In 1998, Bob Wiggs succeeded me, Ed Eisner, as president of the AVDC. In 1999, 2 years after the AVDC was recognized as a full VSO, or veterinary specialty organization, Bob created an ad hoc veterinary technician certification committee with myself as the chair. And Steve Holmstrom and Jan Bellows were members of our committee. And we were tasked with investigating the feasibility of the certification of veterinary dental technicians. I contacted Mr. Patrick Navarre. He was the executive director of the National Association of Veterinary Technicians in America, NAVTA. He indicated that the AVDC would be welcome to apply to NAVTA to be the sponsoring organization of the veterinary dental technicians. He indicated that NAVTA Committee on Veterinary Dental Specialties would be reviewing the application, and that only certified veterinary technicians would be acceptable in order to receive AVMA recognition as a veterinary specialty organization. His recommendation was to duplicate the AVMA requirements for VSO with very minor modifications to the AVDC package. Two colleges had done this in the technicians. They were the Academy of Veterinary Emergency and Critical Care Technicians and the Academy of Veterinary Technician Anesthetists. I enlisted my colleague, Steve Holmstrom, who, as I, had previously chaired the AVDC credentials and examination committees and also was a past AVDC president. And together we modeled a credentials package and dental technician examination in the same image as the AVDC, but with reduced technician requirements in time commitment and level of expertise. These two programs were approved by the AVDC in 2000, and the AVDT was off and running. This is the AVDT now, not ASVDT. Steve and I assisted in administering their examinations for the first few years, just to make sure quality control.
Yes.
I enlisted my certified veterinary technician, Sarah Sharp, to join me in creating an inaugural group of highly motivated technicians to form the veterinary technician group with verifiable, highly qualified dental expertise.
Yes, and Sarah Sharp was one of my original mentors, and I'm so grateful to her and all of her contribution to this, especially
Yeah,
in the beginning there, where you saw the need for technicians to have a higher level of expertise and understanding, not just the veterinarians, right? So that's just
absolutely.
super
Yeah,
important that you were a part of that and had that vision, because we wouldn't have what we have today as technicians without the support of the whole entire veterinary team, including veterinarians like you.
absolutely. So Sarah and I placed open invitations in the Journal of American Veterinary Association and in the Journal of Veterinary Dentistry for people interested in assisting in the development of the newly forming Academy of Veterinary Dental Technicians, the AVDT. We invited them to attend a February meeting at the Western Veterinary Conference in Las Vegas in 2001. I and Sarah arranged for the first meeting in 2001 at the Western Veterinary Conference, and those who showed up were grandfathered in as the organizing committee for the future AVDT specialists. All of the attending 12 technicians were either certified, registered, or licensed veterinary technicians in their respective home state. All had extensive experience either working for or with an AVDC diplomate. It was attended by myself and those 12 technicians. They were Sarah Sharp, Jeannie Viteau, Vicki Baird, Wendy Bauer, Pam Noel, Susan Berryhill, Thomas Koenig, Judy Ozier, Kathy Sylvester, Mary Berg, Jerry Ann Holstrom, and Sue Elder.
And Sue Elder, she was one of my mentors as well. Tommy was my official mentor. I did not know them in 2001, and I did not attend that meeting because I didn't know that was happening. But I met them in 2002 at the Veterinary Dental Forum in Savannah, Georgia. Is that correct? Was Savannah in 2002?
Yeah,
Yeah,
yeah.
so that's where I met them. So that was how I got them on my radar, and
So,
I was like, wow, this is really cool what they're trying to do here.
so at that first meeting, those 12 elected Jeannie Viteau as president, Vicki Bayard was the president-elect, and Sarah Sharp was the secretary. By 2005, the AVDT was self-governing, and my role was as their advisor from the AVDC. It took them 5 years, and in 2006, they were accredited with NAVTA as the third veterinary technician specialty organization designated VTS dentistry.
Yes, that's amazing. We're celebrating our 20-year anniversary this year of
That's
that
right.
accomplishment.
So, generally speaking, providing specialized dental services has been a response to consumer demand. Without consumer wanting it, none of this would ever occur. Just like the whole beginning of the technicians society was because people were tired of having a 1 or 2% death rate in spays, so technician schools started to spring up, and that's how it all gets started.
Yeah, has to start
Anyway,
somewhere.
it's particularly true in preventive aspects of dentistry has become increasingly important as the understanding of the interactions between oral diseases and systemic health has increased. There are now university veterinary dental residency programs in numerous universities in North America. Veterinary dentistry is well established as an important discipline when providing comprehensive health care for animals while optimizing their overall well-being. As of a few days ago, February 25th, 2026, the expanding veterinary dental profession has 293 active AVDC diplomates, 6 equine residency programs, and 77 small animal residency programs approved by the AVDC. And there are 125 VTS dentistry technician specialists, with more making applications as I write. So this is going to be an exciting 20th anniversary for you. Yeah.
Yes, we hope to have a good group there. We're going to celebrate at the Veterinary Dental Forum in Orlando,
Yeah.
Florida in October. And this is a huge part of it, just really even knowing the history and the foresight that these people had to put this all together, and then to be able to be a part of maintaining that and making it better and strong as we work towards the next 50 years.
Yeah. So just to wrap it up, there are 10 key dates in the 50-year evolution of veterinary dentistry. In 1976, the society was formed, the AVDS. In 1986, the Academy of Veterinary Dentistry was formed. In 1987 was the first veterinary dental forum in Cincinnati. In 1988, the AVDC received provisional recognition as a VSO. 10 years later, in 1997, the AVDC received full recognition as a VSO. In 2023, the Foundation for Veterinary Dentistry was formed, board-certified veterinary dentist and veterinary dental specialists becoming registered trademarks. For the technicians, 1990s, the ASVDT was the very beginning with Jerry Schellen and Henry Schein. In 1999, the ad hoc committee of the Dental College was formed. And 2001, the first meeting of the AVDT occurred at the Western Veterinary Conference. And in 2006, the VTS accredited with NAVTA as the third veterinary technician specialist in dentistry. So that's our history. I feel really fortunate just to have been in that time period. In real estate, it's location, location, location. For many of us, it's the time, the time, the time. And if you're there and you're paying attention, you can be one.
Thank you so much for listening in today to the Positive Veterinary Dentistry podcast and part 1 of a 2-part series with Dr. Edward Eisner. It's been really fun listening to his recounting of the history and the humble beginnings of veterinary dentistry. So please stay tuned for part 2 so that you can learn a little bit more about Dr. Edward Eisner, his passion projects, what he's up to today, and his take on the future of veterinary dentistry. We really look forward to it, so I hope we will see you there. And I know a lot of veterinary professionals out there don't know this podcast exists, so we would love it if you would share, like, subscribe, and listen wherever you listen to podcasts. Watch the video on my YouTube channel. For now, keep doing positive veterinary dentistry, and we'll see you in part 2 of this 2-part series.